Hello, everyone. Welcome and thank you for joining me today. We'll be discussing today what is eHealth Exchange. The eHealth Exchange, I'll focus not only on its national importance, but also how it can significantly impact us here in Minnesota. As healthcare becomes more complex, improving communication between providers is critical, and the eHealth Exchange offers a solution to these challenges. I'll be urging our legislator to implement this in Minnesota as we discuss the benefits and what are the barriers that are existing in this program. So first, what is eHealth Exchange? eHealth Exchange is a secure nationwide network that allows healthcare providers, whether they're rural clinics or large urban hospitals, to share critical patient information in real time. Here in Minnesota, we've been early adopters of eHealth Exchange, or HIE, with our own state-level framework. The Minnesota Health Exchange Network, MN HIE, this allowed healthcare providers across the state to share information more efficiently, improving patient care and outcomes. We're also part of the larger eHealth Exchange, which means Minnesota providers can share clinical data with federal agencies, hospitals nationwide. However, despite Minnesota leadership in this area, there's still challenges, especially when it comes to integrating smaller rural providers into the network. Framework care is still an issue for many of our communities. Where are we in Minnesota right now? Minnesota has been an early adopter of eHealth information exchange, and the state had made strides in establishing secure data sharing. And then, as we said, it has its own network, and there are multiple challenges. But why are these important? One major issue we face is fragmentation of data across state lines, which can cause delays in diagnosis and treatment. For example, if a patient in Duluth needs specialized care in Wisconsin, their health records might be accessible without delays. As a lab technician myself, I know how important it is to have real-time access to patient data to make accurate and fast decisions. Without this access, vital care can be delayed. Quick poll, how many of you experience delays in healthcare due to missing or inaccessible patient information? I know some of you guys are nurses, so maybe you can answer this question. We can fix this, though, through eHealth Exchange. Minnesota healthcare providers can seamlessly share patient records, lab results, histories, and improving care coordination, reducing these frustrating delays as we've all experienced them. So quality measurement reporting. Why is this important? Quality measures reporting is crucial to improving care, but too often it's inconsistent. This leads to gaps in patient outcomes, financial losses for healthcare providers, especially those relying on medical reimbursement. In Minnesota, inconsistent reporting has affected the quality of care in rural areas, but by integrating automated quality reporting through the eHealth Exchange, Minnesota can enhance data accuracy and ensure that providers meet Medicare and Medicaid requirements more efficiently. This has been proven to save healthcare providers millions of dollars annually. For example, at Central Care in St. Cloud, automated reporting has improved the reliability of their quality measurements, leading to better reimbursement and a more timely care improvements. So we also have to address certain barriers. Of course, we know there are barriers to fully implement HIE systems across Minnesota. Some stakeholders worry about costs, and others worry about other things, but enhancing healthcare equity is the most important. Another crucial issue we must address is healthcare equity. Many rural and undeserved areas in Minnesota lack access to specialized care, but through the eHealth Exchange, rural labs and clinics can share their results with urban hospitals like Mayo Clinic in Rochester, ensuring that patients in undeserved areas receive the specialized care they need. Take the example of Essential Health St. Mary's Medical Center in Duluth. By partnering with smaller clinics in northern Minnesota, they've been able to offer real-time specialized care without patients needing to travel long distances, like coming to Minnesota. Lab results are shared instantly, and critical decisions can be made much faster than before. This system is not just about improving efficiency, it's about leveling the playing field in healthcare across Minnesota. Everyone deserves the same standard of care, no matter where they live. What are these barriers, like I said? Of course, we know these barriers to fully implement HIE across Minnesota. Some stakeholders worry about cost, data privacy, and the complexity of integrating HIE with existing systems. These challenges can and have been overcome. Let's look at the Lakewood Health System in Staples, Minnesota. Initially, they had concerns about the cost and staff training requirement to implement the eHealth Exchange. However, with state funding and supporting from neighboring hospitals, they were able to integrate the system, leading to better patient outcomes and more efficient operations. By sharing these success stories, we can show that costs are outweighed by the long-term benefits, reduced redundancies, improved patient care, and better staff efficiency when it comes to data privacy. Minnesota has implemented robust privacy measures that ensure patient data is protected while still enabling life-saving information being shared. So my call to action for our legislators such as Tim Walz is. Now let's talk about what needs to happen to ensure that all Minnesota can benefit from the eHealth exchange. It's time to urge our Minnesota legislature to fully support the integration of HIE across all of our healthcare systems. This means allocating state funds to help rural clinics and smaller healthcare providers adopt HIE, encouraging collaboration between larger institutions like Mayo Clinic and smaller hospitals, promoting public-private partnerships to drive innovation and resource sharing. This is where you come in. Whether you're a healthcare provider, an administrator, or a policymaker, we need your voice to ensure that Minnesota continues to lead the way in healthcare innovation. Let's push for Minnesota to expand its HIE infrastructure so no patient is left behind, no matter where they live. Now I'm going to be sharing a few success stories so you guys know where I'm coming from and where we need to go. We've already been seeing great success stories across Minnesota. As I mentioned earlier, Essential Health, but also there's a program in helping healthcare in Minneapolis that has also reported a 20% increase in chronic disease management thanks to better sharing with neighboring clinics across the state. These are real, tangible improvements that demonstrate how eHealth Exchange is transforming care in both rural and urban settings. As Dr. Lisa Johnson from Essential Health St. Mary's Medical Center shared, the eHealth Exchange has truly leveled the playing field, enabling us to provide the same high-quality care to patients in rural areas as we do in urban settings. These patients can be treated equally across the state. Thank you for listening to the eHealth Exchange discussion that I just had. It is not just a tool for improving communication between healthcare providers, it is a tool for improving lives. By making patient information accessible when and where it's needed, we can reduce delays, improve outcomes, and ensure that every Minnesotan has access to the best possible care, regardless of where they live.